This is the biggest act of collaboration in history, and we're all playing our part.
The UN is issuing a global call to action for millions of people around the world to sign up and become information volunteers in order to share trusted content to keep their communities safe.
We are collaborating with one of the world's leading social mobilization organizations called Purpose to launch today an initiative called Verified. And Verified is going to be, among other things, but very centrally, inviting the global public to volunteer to counter this growing scourge of COVID-19 misinformation by sharing UN-verified science-based content with their communities.
Volunteers would sign up at the website shareverify.com, after which they'd receive a daily feed of verified content that's optimized for sharing on social media platforms, with the specific goal of countering those seeking to deceive.
It's not just because there's a scarcity of information. On the contrary, there is a glut of information. But fiction is often circulating faster than fact, and it's endangering public health response, and ultimately it's endangering people's lives. Purveyors of misinformation are creating storylines and slick content that are filling information voids where science has no answers. They offer promises of cures that have no evidence of benefit or may even be harmful. They are savvy about using narratives that link to people's fears and appeal to people's need for answers or need to find a culprit.
The UN will partner with influencers, civil society, business and media organizations in the hopes of rooting out hateful or harmful assertions about COVID-19, like fake remedies or unproven therapeutics or conspiracy theories about vaccines, which have metastasized in recent weeks.
While we still need the basic guidelines, stay at home, wear a mask, etc., we're seeing new information needs and a disturbing rise in hate and stigmatization. And we expect a further increase of targeting of particular groups. Unfortunately, in the algorithm-driven social media era, the popularity of a post often has more influence over who sees it than whether it is factual. So the social media platforms have committed to taking down or are putting up warnings about dubious information and are even guiding people to the WHO website or websites of national health authorities.
A digital battlefield requiring sophisticated new methods to help ensure that the truth and facts still matter, particularly on questions of life and death amidst a global public health emergency. Sherman Bryce-Pease, SABC News, New York.